Heart disease is quite prevalent in the South. In fact, more people die of heart disease in the South than any other region in the United States. Some of the reason is that there's lower socioeconomic status. Some of it is cultural. The diet's a little bit different. Some of it is less focus on walking, exercise. I think access to care may be a little bit more complicated in some of the rural areas. I also think maybe not as many people are focused on or attentive to their own health, the importance of getting your blood pressure under control, your cholesterol under control, avoiding getting diabetes. There are things we can't change. We can't change that we get older. We can't change the genetics our parents gave us, but there are modifiable risks. And if you really focus on impacting those risks and work to optimize them, then you could substantially reduce your risk of heart disease at an early age. Those things are, number one at the top is probably smoking. So if you smoke, do everything you absolutely can to quit. Know what your blood pressure is. Check it periodically. Go to your doctor, get your blood pressure checked. If you don't know your cholesterol levels, find out your cholesterol levels. Diabetes is another major risk. Ideally, you want to not get diabetes. And how do you do that? Well, you live a healthy lifestyle your whole life. Try to limit your carbohydrate intake, and that includes crackers, cookies, muffins, donuts, bread, not just sweets. Exercising regularly. Try to maintain a healthy body mass index. You can limit the progression of disease, and I don't just mean coronary artery disease, heart failure, and other cardiac abnormalities by living that healthy lifestyle and controlling those risk factors that I mentioned. We're all potentially at risk for a cardiac event. Basic CPR is something that you'd hope everyone knew, and that's being able to recognize somebody's unconscious and needs help. If you're alone, call 911 right away, then attend to the person. If somebody's there with you, have somebody else call 911 while you attend to the person who's unconscious. It's important to know you've got to address the airway, make sure the person's breathing, check their pulse, know how to do those things, and to know how to administer compressions to the chest wall, and to know how to administer breathing if that's something that's necessary. The other important thing that everyone should know is that there are automatic external defibrillators that have been dispensed around areas, businesses, public facilities, airplanes, and it's important that the people who are working in these facilities know how to utilize these defibrillators. The most important aspect of heart disease is prevention. We're very reactionary in the way we've approached heart disease. We can address a heart attack rapidly if somebody chooses to seek medical attention when they have symptoms. We can treat heart failure when it's already happened. We can transplant somebody if they need to transplant somebody, but ideally, you want to start by never getting to those points. Do something before it happens.